Oh, hey guys, so maybe we can interact in the meantime while we're waiting. We have like 4 minutes to go. We can interact. Where's everybody from? Yeah, where are you guys joining us from? You can unmute if you want to go and tell us where you're from. We're so excited to have you guys here with us tonight. Okay, now we have 18 participants. Welcome everybody.
Thank you. Thank you.
Thanks, Yvonne. Where are you from, Yvonne? Sorry to put you on the spot. I'm just trying to interact with you as they join in.
Oh, no, it's fine. Thank you so much. I'm glad that I've joined. I just saw it on Instagram.
Oh, that's amazing.
Then I've set a reminder I think it was from last week, Thursday. Then I've set a reminder so that I can be able to join. I'm staying at Captain Park.
Oh, that's amazing. Thank you so much. We are honored. Wow. From last week, Thursday, you sent a reminder.
Yes. I want to learn more.
Yes.
On
Well,
health
for
issues.
whatever reason.
Thank you.
Okay. Thank you. Thank you so much. Does anybody else want to say where they're from? And yeah, maybe what brings them to the webinar. We're so happy to have you guys
Good
here.
evening, everyone.
Hi, Nahanda.
I'm Nehanda. I'm based in Boksburg. I just saw the post on Instagram, so I was keen to know about everything that will be talked about this evening.
Amazing.
Thank you.
I'm so happy to have you here. Sorry, guys.
My name is Francie. Can you hear me? And
yes.
I am from Hartbeespoort, and I'm a friend of Elmarie. And I also saw this on her page, and I wanted to support her, and I want to listen what it's all about. In the meantime, my granddaughter's here. She's writing accounts tomorrow, and she's going to take her grandfather to go study in the other room and leave us all alone.
We love that. We love that. Thank you so much, Francie. Thank you so much for joining. Yeah. Yeah, no, they need to study. It's exam season. And yeah, we know that it's an interesting webinar and she probably wants to listen in. But at least it's pre-recorded. So, and I'm assuming it'll be safe for all.
She's not going to listen in because I just got a microphone and I've got earphones. She can't listen. In 2 minutes from now, you're going to have to switch on my earphones. No. But yeah, thank you. We support you all.
Oh, thank you. Thank you so much.
Good evening. Can you hear me?
Hi. Yes. Welcome. And
how are you?
Good. How are you doing? Thank you for joining.
Good. Thank you for sharing it with us. We're so proud of you. We're here to support you, Chomi.
Thank you so much. Thank you so much, friend. And hopefully we can all learn from the professionals that are here tonight that can, give us all the advice that we need and, just navigate.
We all have issues here and there, so we're really here to learn. Thank you so much for sharing this with us.
Thank you. Thank you, friend. Okay, so it is now 7 p.m. I think we can start our webinar. So I will start by introducing myself. I am Thulaganyo Mekoli, and good evening, beautiful women and guests. Hopefully, gentlemen are also joining us as well, that are in support of us women as we navigate this journey. Welcome to the RODI Wellness webinar, titled Restoring Balance, Understanding Hormonal Health and the Journey to Wholeness. My name is Thulaganyo Mekoli, and I'm honored to be your host tonight. I just wanted to start with a grounding moment. So before we begin, I'd like to invite all of us to take one deep grounding breath. This space is for you, a space to learn, to feel seen, and to be empowered. Okay, so in my own journey, menstrual health has been a very real challenge. And today was actually one of those difficult days for me. I've always struggled with a heavy flow and severe period pains. So for me, on a typical day, I would use up to 6 to 8 pads in a day. And I'm an engineer, and I work in a predominantly male dominated environment. And on site-based days, it makes it very difficult because the facilities are so far from where we are working, and it is not really designed for women. So I often have to drive back to the main building just to manage my flow. And I come from a health affiliated family, and I started hormonal contraceptives at the age of 13 to help control my symptoms because I used to miss school from the period pains. They were so severe. And over the years, I've tried almost every available hormonal contraceptive in South Africa just to manage my flow and all the symptoms. And I'm now currently on a non-hormonal copper T, and I really thought my struggles would be over. So I'm still navigating the same struggles. And tonight I share this to highlight how many women silently push through experiences like these, and why conversations like today's ones are so important for awareness, support, and practical solutions. So we have a few ground rules. Can we please switch off our cameras and microphones unless we are asked to speak? This is a respectful environment, and please let's be mindful of our language. And yeah, we can use the chat box to engage after every speaker to ask your questions. You can just pop them in the chat box, and we will try and attend to them as fast as possible. And tonight we have our first speaker, Tlengiwe. She is an endometriosis and nutrition specialist, and tonight we begin with a powerful story of healing and transformation. Endometriosis advocate and nutritional life coach Tlengiwe Shakung will share how her nutrition supported her journey to hormonal balance and wholeness. Tlengiwe, over to you. Welcome. I don't know if you have joined. We also have a poll on the screen. Please participate. And tell us what brings you to this webinar. But in the meantime, over to you, Tlengiwe.
Hi, Tuli, and hello, everyone. I hope you can hear me. Please do that for shout if you can hear me.
Yes, we can hear you. So I'll just mute myself now in the meantime.
Awesome. Thank you so much. Thank you for the warm welcome, and welcome to everyone else that is here. My name is Tlengiwe Shakung, also known as Shlings. I'm an endo warrior, as mentioned, and I also, which means that I live with endometriosis. I'm also a health and nutrition life coach as of recent. So I'm really grateful to be here with you tonight. And before long and before any big title, basically, I'm a woman who's walked a long, painful, and complicated role of hormonal imbalance and endometriosis. So just first to start to introduce, to give people an idea of what this endometriosis thing is. It's a very gruesome, not so great chronic illness whereby similar tissue that is similar to that which is found inside of the uterus grows and manifests outside of the uterus. Now, when I say outside of the uterus, I don't mean literally on the outer parts of the uterus, but I mean in any part of the body outside of the uterus. So this could be in your bladder, your kidney, your stomach, your lungs, your heart. So any part of your body inside, internally, that is not your uterus. It comes with debilitating pain. It comes with debilitating, painful periods. There is fatigue, unexplained fatigue. There is high chances of one even having fibroids or PCOS. You are susceptible to UTIs. There's just a lot of things that are involved in someone having endometriosis. So it's not a great thing to experience. I was diagnosed with this illness in 2020 at the height of COVID-19, and but symptoms started long before then. It was a journey for me to get to diagnosis, but I am here, I am standing, and I'm using my story to change the lives of other women and other people who may be battling with this illness, or maybe any other hormonal imbalance, hormonal issues, and hormonal related illnesses. So tonight I want to speak from two places. I want to speak as the woman who has lived through this and the coach who now helps others navigate this. My journey with hormonal balance didn't start the day I was diagnosed with endometriosis. It actually began long before that. In the confusion, the pain didn't make sense to me. The exhaustion that people mistook for laziness and the symptoms that were dismissed as normal. I remember losing days, even weeks, to pain. I remember the fatigue that felt like it lived in my bones. I remember how unpredictable my body was. One day, fully functional, the next day, completely shut down. Now, like many women, I didn't have the language for what was happening. I just kept pushing through, hoping it would pass. And when the diagnosis finally came, it wasn't a relief. It was the start of a whole new battle. But at the same time, it was a relief because it meant that I finally understood what was going on and what was wrong with me, so I could start making some sort of change. Now, along the way, obviously, as anyone knows, when you are battling with some sort of health complication, you try to find out what works for you, what you can do for yourself, because going to doctors is quite expensive. So you can't always run to the doctor to get help to find out what is going on with this. You're very limited in getting medical access for the answers that you need for whatever health challenge that you may be experiencing. Now, in between all of the appointments, it meant that I needed to be more intentional about finding out what actually is wrong with me beyond getting the diagnosis and the words, you have endometriosis. I needed to find out what I can do better for myself, how I can heal myself outside of, here's some pain medication for you to take. This is it. This illness doesn't have a cure. I needed to find a way to continue living because everyone knows life doesn't just stand still when you get life-changing news. Life doesn't stand still when you're going through something. Life goes on. We've got bills to pay. You've got many challenges and many things to do. You've got a family to look after. You're a sister, you're a mother, you're a caregiver, you're a full-time working person. There's a lot of things. So one needs to find a way to better navigate that illness. So where nutrition entered my journey, Basically, one of the biggest wake-up calls for me was realizing that although I couldn't control everything about endometriosis, I could control how I supported my body. The turning point came after I had a flare that was so bad that I knew something had to change. Because I basically didn't want to keep popping pills in my mouth. I didn't want to keep taking all this medication and feeding my body things that can help temporarily, but things that can also be harmful. So I remember asking myself, what if I could help my body fight with me instead of feeling like it was fighting against me? That's what led me deeper into learning about hormonal health, inflammation, gut health, and the power of food. So this wasn't about a miracle diet or false promises. It was about understanding a few simple things that everyone can relate to, endometriosis or not. And that is, food communicates with our hormones. Number 2, what we eat affects inflammation. Number 3, gut health impacts pain. Number 4, stress and sleep shape hormonal balance. And finally, small changes can produce powerful shifts. The more I learned, the more my body responded, gently, slowly, but surely. Now, I don't mean that everything was perfect, but it helped on some days and in some instances. Now, that curiosity mixed with desperation and hope is what pushed me to study health and nutrition formally. I didn't just want to survive, but I also wanted to understand, and I wanted to heal, and I wanted to help other people do the same, especially women. I always say this, nutrition is not a cure for endometriosis, but it's a powerful tool in the toolbox. So here are 3 of the most important ways it helps. It reduces inflammation because endometriosis is an inflammatory condition, and certain foods can reduce that inflammation while others fuel it. Number 2, supporting hormone balance, because hormones don't work in isolation. They depend on nutrients, a healthy liver, stable blood sugar, a calm nervous system. Now, having balanced meals helped stabilize my mood, my cravings, and even my cycle irregularities. And then finally, strengthening gut health. So most people don't realize how deeply digestive health and hormonal health are linked. Once I focused on fiber, hydration, and probiotics, I felt a noticeable change and shift in bloating, energy, and overall comfort. I want to be honest though, healing is not a straight line. I have had hard days. I've even had recent hard days, and I'm currently recovering from that hard day or those hard days. I've recently had surgery, and that's part of those hard days for me. I still have hard days. I still have moments where I have to pause and listen to my body, but I'm no longer at war with myself as I was, say, 2 years ago. Today, I live a far more balanced, mindful, and empowered life than I did previously. I have rhythms that support me, like nourishing foods, gentle movement, rest without guilt, intentional stress management, and a deep respect for what my body carries every single day. Now, if there's one message I want to leave with you tonight, it's this: your body is not your enemy. Your symptoms are not shameful, and your healing doesn't require perfection, only awareness and patience and compassion. So hormonal health is a journey. It's not a destination. Every step you take adds up, and you deserve to feel at home in your body again. It's your body, it's your temple, it's where you are resting and working and functioning every single day. So you need to be gentle with yourself while trying to find what works for you. And don't ever feel bad or feel like there's something terribly wrong with you if something works for Didi, something works for Brenda, something works for Almarie, but it doesn't work for you. You'll find what works for you. Your body will tell you once you found it, and you'll celebrate with yourself. So obviously I'd have more, but I welcome any questions on the platform and even outside. But thank you for sharing the space with me tonight. I'm really honored, and I would love to walk this wellness journey with you. Thank you.
Sure, that was amazing. That is so amazing. Thank you so much for your vulnerability and your insight. It has truly been a journey, and I am truly inspired. And yes, I will have to agree with you. Gut health, I definitely need to work on that. Definitely. Yeah, but ladies and gentlemen, you can please pop any questions that you have for Thengiwe in the chat section, and at the end we will have a Q&A for those of you that want to interact or want to say your questions out loud. But thank you so much for sharing that story. And then I think we'll move over to Elmarie, and maybe we can also put a poll after Klingiwe's talk. But in the meantime, Elmarie, welcome. Thank you so much. Elmarie is our psychologist, and she will probably be telling us about hormonal imbalance, that it's not just physical, it affects our emotions and mental well-being. To guide us through this emotional landscape, we have psychologist Elmarie van Perrine. Elmarie, thank you so much. Take it away.
Thank you very much. Thank you to all of you for being here. And I see some faces that I recognize. I see Susan and I see Francie. And welcome. Yeah, I'm honored that you support this journey. But on an emotional level, I think that if I look at the faces and the people joining tonight, I think we cover quite a lifespan span of ages. We've got young ladies and up to older ladies here that's been through the menopause and so on. So Susanne and I think Francie can relate to that. And maybe that is the reason why they are here tonight. But my topic that I need to discuss tonight is about the emotional impact that hormonal changes have on us. So hormonal harmony is crucial. And once that is disrupted, it can absolutely cause havoc in one's life. And as we are women, it changes constantly. We go from teenagers where we are not menstruating to teenagers where we do menstruate. And then we have pregnancies, and then after pregnancies, we've got this, and then after that, we go through menopause and so on. So the landscape is constantly changing, and we have to change with the constant change of the landscape. Now, the emotional impact can only be managed if we experience it not as a victim, but as a survivor. And what our previous speaker said so well is, and I think our talk is quite overlapping. She coming from a nutritional side and I come from an emotional, mental side. But the basis, and I think holistically, the basis stays the same. So on an emotional level, it is very important to have self-awareness. Once you are self-aware of what your body is going through, and I find that the older I get, this is one of the tools that I really use in my toolbox. And that is to tap into yourself, into your own body, by asking yourself, what is it that you need right now? We know we can read articles, we can talk to professionals, we can talk to other people. But once you go through all that, there's some anxiety and some uncertainty. So the minute that you tap into yourself by asking yourself, what is it that you really need right now? 9 out of 10 times your body knows the answer. I think we must trust that inner voice, and that is very important. We spoke about, or the previous speaker spoke about a calm nervous system. Now, I brought the whole toolbox here with me. I first thought maybe I should use a slide, but then it's too academic, and then we tend to forget. So I've got a vast selection of soft toys with me, but I'm going somewhere with that. So if you look in the middle of the brain, there is a little shall we say, a gland, which we call the amygdala. And that is not the part that we use for cognitive function. It's not your prefrontal cortex. It's right in the middle. And sometimes when we are overwhelmed by feelings and do not know what to do and we become anxious and angry, it is the amygdala speaking. And then we can't make good choices. And that in that instance is when you feel the victim. So for the purposes of this meeting, let's call her Amy. So Amy is reaping havoc with our emotions. And once we can sort of guide the amygdala and quiet the amygdala, we can quiet down our nervous system, where we can make responsible choices. So we all know about the fight and flight and freeze mode of the cortisol being released by the adrenal glands and so on and so on. And that becomes very academic. But I want to make it very easy for us that we can always remember this. Not underestimating your intelligence, just to make it easier for us to have a tool. So if we can divide it in 3 sections, and we say the upper section is the fight and the flight. When you fight, you become angry, you become irritated, and we know irritation is quite a thing with hormones, and anger, and quick to anger, and so on. If we take that as the flight and the freeze response, I'm going to explain it by this little animal. Do you see the little tiger? So the little tiger becomes loose and reacts. That's not where we want to be. And if you are constantly here in this phase, it is very draining and you become very tired. And it's not good for your interpersonal relationships. We can't be here. I've got another one which looks like this, which is this real dinosaur with, and so on. So that is the fight and flight. And sometimes the flight is necessary. We need to flee for our own sake, but we can't be in the constant phase of the tiger. Then when we go to the bottom phase, we are here with this little tortoise. Do you see this little tortoise? That's also not the good part to be in, because the tortoise will hide away in his little hideaway, and he doesn't want to mingle. He doesn't want to see other people. It is totally isolated, and that's also not a good place to be. Where we want to be and where we want to regulate our emotional state and our nervous system is to go back to this phase, which is the little owl, which is calm, collected, and wise. And when we are in this state, emotional state, we can make good choices. We can then focus on your gut health, your diet, movement, exercise, and so on. So that is important. But how do we get to this phase, this little owl phase, which is the regulated? The nervous system is very well regulated in that phase. How do we get there? And that is where we get to mental health. And the mental health is so important. And how can we regulate that with our emotional well-being? And our previous speaker also spoke about gut health. Now, gut health and the health of our gut is in a sense called our second brain. So you've got your brain that you think with. Now we've got the amygdala, which cannot think for herself. She only can react, and we want to calm her. Then you've got your cognitive function with your prefrontal cortex. And then we go to the gut, which is our second brain. It is said that up to 90% of serotonin that we need for emotional well-being and not to be depressed is manufactured in your gut. So that is very, very important. So what happens is we tend to get medication for that. It doesn't help, or we are totally overwhelmed. Instead of looking into the gut health, where the gut is in tip-top condition and secretes its own serotonin. That is where we want to go to. Isn't that interesting? So apart from that, apart from the gut health, what else can we do? And that is all to do with mindfulness. If we go mindfully into this journey, it makes a huge difference. So mindfulness is where you train yourself, where you educate yourself and you get the knowledge so that you can use your self-awareness and be accountable to actually use those techniques on a daily basis. And that will be to be knowledgeable about the vagal nerve. So we know about our central nervous system, and we know a lot about that, of the autonomic nervous system and so on, but not the vagal nervous system. So the vagal nervous system, the word vagal means a nerve that goes around all your organs on the outside, not in your spinal column. And that is when we incorporate things like mindful walking and meditation, nature, creative art, and we've got an artist on our group as well. I saw Francie, which is a good artist and well known in our area. So if you do incorporate those, being creative, doing art, doing writing, doing journaling, that helps your mental well-being. And I think I'll stop here. That's a lot of things to think about, but you are more than welcome to ask questions now.
Thank you so much. Thank you so much, Marie. That was a very powerful message. Thank you for that. I want to be that little owl. I'm pretty sure everybody wants to be the little owl. But yeah, I think we can pop questions in the chat box again, guys. Thank you so much for the interaction that is there. I can see it. There's a poll up. Please interact on it as well. And yeah, without wasting any more of time, we are going to move over to our physiotherapist and hormonal health, Neshri Naidu. Donnie couldn't join us today. She's also a physiotherapist, but yeah, healing is often begins in the body. So I think Neshri will tell us more about that, how we can explore physical manifestations of hormonal imbalance and how movement can support pain and relief. So thank you so much. Neshri, please take it away.
Okay, hi. Thank you so much, Julie. Okay, so I'm Neshri. She already did quite a good introduction. I'm a pain specialist and a pelvic floor and women's health physiotherapist. So I'm just going to touch on, hopefully briefly, on how hormones affect you physically and what the pelvic floor actually does in all of the situations. So previously, Almarie already touched on how the nervous system works, how you need your vagus nerve to incorporate into wellness. So that's also what we touch on as well, but I'm not going to go into that. So you're probably wondering, what is a physiotherapist doing on this talk about hormones, but we actually have a lot to do with it. So hormones play a vital role in how your body functions, whether it be affecting your energy levels, muscle tone, pain sensitivity, and your pelvic health. So any hormone fluctuations or any imbalances usually will manifest physically. And how does that happen? So usually when we go through different cycles as women, be your menstrual cycle, perimenopause, postpartum, thyroid changes, or even high stress levels, even with males as well, it can influence the way your pelvic floor and your surrounding systems function. So if we look at exactly what the pelvic floor is, I hope everybody can see. So if we look at this model, is it clear?
Yeah.
Okay, cool. Okay, so if we look at how the pelvic floor actually functions, if we see how it sits at the bottom, it's like a bowl, like a cup. So it consists of all of these muscles surrounding our vaginal opening, urethra, and rectum that covers and sits functionally to support all of our structures. Inside of our pelvis, you'll find you have your bladder sitting. your ovaries and your uterus, and then your rectum at the back. If I have to remove these structures, which we are just going to do for demonstration, you can see how the pelvic floor muscles actually sit and encompass all of these structures. So if we have issues with our pelvic floor muscles, it's going to also influence our internal structures, and also by that means it's going to also influence our nervous structures and our blood flow as well. When we have something, well, let's touch on endometriosis, an inflammatory condition. Because it's in the uterus and outside in the tissues, what happens is it influences the way our body functions. So what happens is the body starts to tighten up to support the body a little bit more, to give it a little bit more function. But in turn, it causes an imbalance in the whole system. Now, everything works as one. Nothing works. Everything works together. Nothing works as one. If we look at when we feel pelvic pain, you're going to have increased sensitivity in your tissues, in your nervous system. Even if you have fatigue, it's going to cause the muscles to start working in different ways, not doing the functions that it's supposed to do. And then when we talk about muscle tightness and tension, you won't necessarily come to me and tell me I have pain in my pelvic floor. You're going to come and tell me I have back pain, hip pain, leg pain, neck pain, or even jaw pain. So when we assess and we do a thorough assessment, and we might find that the pelvic floor is actually the issue, we need to work with all of these surrounding systems so that we can influence everything else indirectly. So when we influence the hormones, as physios, we cannot influence it directly. We influence all of the other structures so that we indirectly influence all of the hormones. So how do we actually do this? So movement is our biggest help. As physiotherapists, we are experts in movement therapy, exercise, and knowing how the body functions and reteaching it how to move properly. So it's a powerful tool for regulating the nervous system, muscle tension, and improving your hormonal balance. So if we look at how it supports us during all of these changes, we can influence you by teaching you concepts to help the body maneuver itself to rebalance so that it will rebalance all the other systems. So if we take how the pelvic floor actually works, I'm going to stand up and hope that you can see me. Okay, so if we look at where our diaphragm is sitting, I'll turn to the side. So our diaphragm sits like a dome here, and our pelvic floor, let's actually use this here, right? So our diaphragm sits like a dome, and then our pelvic floor sits like a dome, like a bowl on the other side. So when we start to breathe, what is supposed to be happening is, if we think of it as an accordion, when we inhale, diaphragm expands upwards, pelvic floor relaxes. As we exhale, everything needs to come together and work in sync. So if that's not happening, if our breathing function is not happening, it means we're not getting enough circulation, we're not getting enough air into the muscles, we're not activating our core muscles to activate our pelvic floor. So everything there, again, works in sync. When we use movement, we use movement with breathing. We cannot use movement without breathing. If we do that, we do not get the correct function. That means other muscles will start to work or do a function that it's not supposed to. So when you are doing your movement exercises, you need to make sure that you are breathing correctly by activating the diaphragm, which we are going to go through in a bit. So what I'm actually also going to touch on that I've been asked to is postpartum back pain and bladder issues. So if we look at why back pain happens after postpartum. So after childbirth, it's common to experience back pain due to physical and emotional changes that your body has been through. Why does it happen? We have weak core muscles. The pelvic floor changes because of the expansion in the pelvic floor and in the pelvis. Your hormonal effects, the relaxant that is given off during pregnancy and during birth, stays on after delivery for quite some time. Relaxant, obviously, as it says in the word, it relaxes the muscles. So which means it makes the pelvic floor a little bit weaker. So the structures that are within the pelvic floor is not going to function as it did before. And then obviously postural changes. You tend to not breathe properly. Your diaphragm, because you went through a traumatic, your body thinks it's a traumatic experience, your vagus nerve starts to shut down a little bit and your diaphragm stops working properly. And that's where we find that we're getting all of these pains. Whether it's a natural birth or a C-section, we can have postpartum pain. And obviously, whether you're going through natural birth, you're pushing, you bring a lot of pressure in the whole cavity, which puts pressure on your pelvic floor. And a C-section, we're cutting through a lot of layers of tissue and muscle and core muscles. So that support that your back has had before and that your pelvic floor has had before is now a lot less. So how do we usually help this? It's usually targeted exercises to rebuild you. Breathing is number one. Postural retraining for daily activities, and manual therapy is very important. We need to release the outer structures, and even if we need to, the inner structures of the pelvic floor. So sometimes if necessary and really severe, we go in through the vagina and we release the muscles around the pelvic floor if necessary. And then what happens after birth also is another common thing is your bladder incontinence. I'm sure lots of women suffer with this. It's not normal. It does happen, but it's not normal. So what happens to bladder in your pelvic floor? So it's sitting right here nicely in the front. When we push or even a C-section, we lose the elasticity of the ligaments. So your pelvic floor drops a little bit. What happens then is that the bladder will you'll either get an urgency type of incontinence, which is where you are pressed to go to the bathroom and you cannot hold it. And that could be because of anxiety, increase in anxiety. So the nerve constantly tells you to empty. Or it can be because the pelvic floor is holding on too tight to the sphincter of the bladder, and then it constantly wants to release. The other thing you could have is stress incontinence, which is leaking with pressure. So coughing, sneezing, jumping, or lifting, which is the most common. And then you could have a mixture of both, right? The thing you need to remember is it's not normal and it can be fixed. So what we do is we first need to assess which structures are going to be the issue, most of the issue, which muscles. We cannot influence the ligaments directly again, so we influence the muscles of the pelvic floor by doing breathing exercises and what you would possibly know as Kegel exercises. So we call it pelvic floor activations because Kegel exercises are usually not explained very well. So what they usually say is you need to clench, you need to tighten. But what are we tightening? We don't know what we're tightening. So what you tend to do is you tighten everything, including the buttocks, including the thighs, which are not supposed to actually support the pelvic system. We tighten so much that we form trigger points within the pelvic floor. And that causes pain. Okay, so when we do Kegels or we do pelvic activations, we do it with breathing. So again, your diaphragmatic breathing. So if we hold our diaphragm and we take a nice breath in, your tummy should expand, your diaphragm should lift up, you should feel a drop in your pelvic floor. So not a tightening, you should feel a drop. As you exhale, when we exhale, we want to connect the rectum to the vagina, to the bladder, all the way up to the top pubic bone into our deep core. When you exhale, everything tightens, and we close. So you should see the tightening in your clothes. So we inhale and exhale in. And that should activate your pelvic floor. You should feel a lift, not a tightening and not a clench. Okay, it's very important that when you're doing these exercises that you do your breathing and that you rather seek professional help if you are not understanding exactly how to do it from Googling or hearing it from other people. Okay, so the other exercises that we can possibly do is relaxation of the pelvic floor. That's usually post-birth when you need to relax the pelvic floor, because what happens is it tightens to protect the whole body. So I'm going to try and demonstrate. So we've already done the breathing. I'm going to try and just change my surroundings. Okay. So if we try and relax the pelvic floor, you want to do something called the child's pose. So usually shoes off. Your bum is on your heels. And then we are slowly going to put our hands down and relax the entire body. If your pelvic floor is tight, you will find that you will not touch your heels. Don't worry about that because it gets better. When your pelvic floor is looser, you are able to touch your heels completely and relax the entire body. So that's one avenue. The other one is we call pelvic rocking. So you in all fours, and basically you're rocking forward and back. And you're doing this while you're breathing. So we're inhaling and we're exhaling. We're inhaling and we're exhaling. And then another one, which is really easy, is called the cat-cow. So it's basically arching your back. So let me try and do it this way. So we're arching the back up. And then as we exhale, we are curving as much as possible in. All the time, breathing. So inhaling and exhaling. And you do it at a slow pace. It's not a fast exercise. It's a controlled exercise. When you start to learn to relax your pelvic floor is when we usually then strengthen the pelvic floor. And that exercises is, we do part of it is Kegel, and then part of it is obviously a tailor-made plan according to what we need to fix. So we're not going to go through all of these strengthening exercises. That you have to see a specialist to tailor-make your plan. And that happens as you go along. So the take-home message that I would want to say for everyone is you don't have to just live with it. Pain is not normal. Urinary incontinence is not normal. We should not be living with it as men or women. With the right support, education, guided exercise programs, postpartum recovery, going through changes through menopause, any pelvic pain, even a big one is sexual pain. It should not be there. You should not have pain during intercourse. It's not normal. So if you are, please reach out to your closest pelvic floor therapist to do a full functional examination and give you what you need from there. I tried to touch on everything. I hope I did. But you can definitely ask questions and I'll be happy to answer at the end of our presentation. Thank you so much.
Thank you. Thank you so much, Neshri. Wow. I'm pretty sure I was not the only one doing the pelvic floor exercises and the breathing exercises while you were talking. Yeah, that was very interesting. And thank you so much for that. Yes. And please drop any questions for Neshri in the comment section, in the chat section. And coming up next to deepen our knowledge, we now turn to obstetrician. I always struggled with that word, obstetrician and gynecologist, Dr. Koketsopule. She will walk us through courses, diagnosis, and medical interventions for hormonal imbalance. Dr. Pule, welcome. Thank you so much, and over to you.
Thank you for having me. Are you able to upload my slides? Hello?
Let me just check. Yes, I think, yes. There we go. Thank you so much.
Are they fine like this? Should we put them on presenter view? I'll try be as interactive and not so formal. So good evening. My name is Dr. Kay Pule. Yes, I am a OBGYN, but most importantly, I am a woman who has had her own challenges in terms of hormonal imbalances, trying to find a balance from changes of my hormones, transitioning from not being pregnant to being pregnant, and postpartum as well. But today we are going to look at how hormones influence mostly every aspect of a woman's well-being, including your energy cycles, your fertility, your mood, your metabolism, and long-term health. So what entails hormonal imbalances? So hormonal imbalances are disruptions in your endocrine system. And this usually affects your menstruation, your fertility, your mood, your metabolism. And they are common across all ages from adolescence through your reproductive years into your perimenopause and perimenopausal transition. Each of these hormones play a unique role, and the key hormones include your estrogen, which is important for regulating your cycle, your bone health in your youth and into your menopausal years. It stabilizes your mood. And most often than not, for those who are desiring fertility, it does prepare your uterus and your uterine lining to receive the fertilized blastocyst. So after conception, the estrogen makes a buildup in your uterine lining. And if conception doesn't happen, if you don't fall pregnant, this lining that it sheds. So it's usually then supported by progesterone. So if you don't fall pregnant, the level of your progesterone then drops. So progesterone helps regulate your cycle, your mood as well, your cycle as well. So if your progesterone is withdrawn, if there is no pregnancy, the hormonal changes that you will feel will affect your uterine lining. So the cramping that you feel when you're going to your period and the shedding of blood is because of a withdrawal of the progesterone. And some people will have mood swings with their PMS symptoms. This is attributed to the progesterone withdrawal. And your other important hormones are what we call androgens. One of the androgens that we commonly know is testosterone. And yes, testosterone is mainly a male hormone, but females do produce this hormone in smaller amounts to males. And in women, the testosterone regulates our libido, our sexual drives, our energy levels, and hair distribution. And other hormones include your thyroid hormones that regulate our metabolism and our energy levels. And any dysregulation in these hormones can disrupt your menstrual cycle or regularity. And the other important hormone includes your insulin, which is important for glucose regulation as well as your weight fluctuations. Go back. So one of the common hormonal imbalances that's often talked about these days and that most people know is polycystic ovarian syndrome. So the main driver of this hormonal imbalance or metabolic imbalance is insulin resistance. And this then increases your androgen production. So there's an increase of testosterone, an increase of estrogen, and these excess hormones then disrupt your ovulation, leading to irregular cycles. And the issue with PCOS is that it's a metabolic disorder as it increases insulin resistance. When you're insulin resistant, then you are prone to gaining weight. And when you gain weight, that can lead to excess production of other hormones because your fat also produces hormones. And when these are in excess, they can contribute to the hormonal imbalance that then leads to irregularities of your menstrual cycle. And the common symptoms include your acne. So when you have acne with this syndrome, it's because of the excess production of the androgens, the testosterone, the insulin resistance comes into play. Your high androgens or high testosterone levels lead to the acne, abnormal hair distribution. So you'll find women that grow hair on their chin. So we call it a male pattern hair distribution. So you get females that get beard or hair on their chest or overgrowth of hair along their thighs. And this is really the imbalances of hormones that are attributed to the polycystic ovarian syndrome. What are the treatment options for polycystic ovarian syndrome? The most important treatment modality, like most chronic illnesses, are lifestyle modifications. So essentially living a healthy lifestyle, exercising, maintaining a healthy BMI, essentially maintaining a healthy weight. And the lifestyle modifications, maintaining a healthy weight, then helps improve the insulin sensitivity. So people who are prone to having insulin insensitivity are people who gain what we call visceral weight. So fat around your organs, around your waist, your central obesity. So those are people who are prone to having insulin resistance. And maintaining a healthy weight will then help balance this hormonal imbalance or insulin resistance. So hormones regulate the cycle and they reduce heavy bleeding. So if someone comes in and they have an irregular cycle, either heavy bleeding or irregular cycle, it's a hormonal imbalance. And contraception, depending on what's within the contraception, hormones themselves. So the word contraception is a misnomer because everybody associates contraception with the prevention of pregnancy. But that's not what contraception is only. Contraception is a combination of different hormones that target different symptoms, and the prevention of pregnancy is also like a byproduct of it. So contraception have a lot of role in a lot of hormonal imbalance disorders, and they come in different formulations. And so treating PCOS has to also do with what the woman's goal is. So a woman comes to you with what we call PCOS. You have to determine how old is the patient, have they completed a family, or is this a patient who is desiring fertility or to fall pregnant. And for those desiring to fall pregnant, it becomes difficult to fall pregnant when your cycle is irregular or when you're not certain if you're ovulating or not. So for those who are desiring to fall pregnant, we use what we call ovulation induction agents, and one of them include what we call letrozole, which is also a hormone that helps the ovaries to ovulate. And then we use androgen medication, so the anti-testosterone medication, to target the overgrowth of hair. As I said, the excess testosterone, the excess androgens cause the abnormal male pattern hair growth in females. So there are medications to counter these side effects. So getting into the other issues, your menstrual irregularities. So an irregular cycle usually indicates that ovulation has been disrupted, and we always have to investigate what the cause is, depending on how old you are, if you're on any contraception, because there are other forms of contraception that can disrupt your menstrual cycle, either make you not go to your period completely or make you only spot during your cycle. So we have to find what the underlying cause is. One of the underlying causes, it could be PCOS itself, thyroid disorders, or hyperlectin levels. So you find that you get hyperlectin levels in females or women that are breastfeeding. So that's why you find that when you are breastfeeding, you sometimes, most of the time, especially in the first year, you don't go to your cycle. But there are other disorders that can cause a hyperlectin level, either growth in your brain that produce this hormone in excess. So we have to investigate what the cause is and treat the underlying cause. The very important thing that has been stressed in today's talk is a healthy sleeping habits and stress management. Stress levels increase cortisol. Cortisol is the stress hormone, and once this is in excess, it can disrupt your hormonal health as well. I have been diagnosed with IBS, irritable bowel syndrome. So when I have stress, there's an excess of cortisol that's secreted from my adrenal glands, and that then disrupts my gut health. So everything works together. So nothing works in unison in the body. And what's important as well, extremes of weight can cause menstrual irregularities. So people who are obese or sudden weight gain, and the opposite is true. Your athlete or someone who starts a rigorous diet and exercise can have menstrual irregularities, because this causes hormonal surges in your body. Your cortisol goes up. So extremes of weight or rigorous exercising can cause menstrual irregularities. And the other menstrual irregularities that comes with aging is when a woman is transitioning into menopause during the perimenopausal transition. So what are the treatment options for menstrual irregularities? So we have to investigate the underlying cause, and we have contraception. But contraception, as I said, they're essentially hormones, and the contraceptions are not the same. They come in different formulations, different dosing, different hormones. So someone might come in wanting to prevent pregnancy, but there are other side effects or symptoms that they may come with. So if someone has a bad period pain, you have to find what the underlying cause is. It just the withdrawal of progesterone? And so you have to target the symptom with also preventing pregnancy if that is the desire of the woman. So if someone comes with acne, you have to also give them a contraception tablet that has more anti-androgenic effects, meaning that it will also target the skin as well as preventing the pregnancy. So there are other symptoms. So not every contraception, you can't apply a blanket approach in terms of contraception and the symptoms that you are targeting. It's important to manage stress and improve sleep. We can't emphasize that enough. And some women with menstrual irregularities may bleed a lot to a point where they lose a lot of blood and drop their blood level. So it's important to take your iron supplements as would be prescribed by your healthcare professional. So once you feel dizzy, tired, you need to check your iron levels, especially if you have heavy periods. So moving from your adolescent into the reproductive years, as we mature, we transition into menopause, and the period before menopause, we call it the perimenopausal transition. So this is marked by fluctuating estrogen and progesterone levels. So when a woman is born, you are born with a set number of eggs, and these eggs decline with time. And these eggs from your ovaries produce the hormones, your progesterone and estrogen levels, in communication with your brain to regulate your menstrual cycle. But as these eggs decline in number, the production of the hormones also decline. So towards your perimenopause into menopause, the number of eggs then get depleted, and then there is no longer enough estrogen or progesterone that gets secreted from your ovaries. During the transition, then women experience irregular cycles, hot flashes, sleep disturbances, and some women may experience mood swings. And these mood swings may often be misdiagnosed as depression or other psychiatric disorders. So it's important to be cognizant of the stage that a woman is in, and be mindful that menopause or perimenopause on average happens from the ages of 41 and 51 on average. Anything before that needs to be investigated and is not natural. And the decline in these hormones can also cause vaginal dryness, mood changes, as I said, your libido decreases, and you have heat intolerances and hot flashes. So you no longer have the sexual desire. But as I initially said, estrogen is also important for your bone health. So as your estrogen declines, your skin starts to sag, your breast starts to sag, but your bone health, the strength of your bones also decline. So it's very important that as we are at where we are now, we start taking care of our bodies, eating healthy, doing strength training, because once these hormones decline and are depleted in your body will remember how you were taking care of it in your prime. So the reasons of your perimenopausal or menopausal symptoms are attributed to the decline in hormones, as I've said, and I've explained the symptoms. So how do we diagnose all these hormonal imbalances? We do a battery of tests depending on who you are, how old you are, and the symptoms you come with, and the labs may come and tell us whatever numbers may come back. But what's important is to treat the person in front of you and not necessarily numbers. And these lab tests may be accompanied by ultrasound examination, but if there's no access to ultrasound examination, it's not the end of the world, because we use a combination of tests to either confirm or refute diagnosis. So what now are the treatment options for women who are in the perimenopausal phases transitioning into menopause? Hormonal therapy is the most effective treatment for hot flashes and sleep disturbances for eligible women. So there are conditions that can preclude you from using hormonal replacement therapy. So it's important to check in with your healthcare professional, make sure that you don't have any contraindications to using hormonal replacement therapy. So it's not for everyone. Anyone with active breast cancer, endometrial cancer is precluded from using these hormonal replacement therapy. Any uncontrolled hypertension, liver disease, any active blood clots, either in the chest or the legs, you're precluded from using hormonal replacement therapy. But there are other non-hormonal therapy for your vasomotor symptoms, and some of those treatments may include your psychiatric medications that can be discussed with your healthcare professionals. So these are some medications that may be used for depression or anxiety symptoms. And for women who are experiencing vaginal dryness, so the vaginal dryness can also predispose you to recurrent urinary tract infections. So as you grow and the estrogen declines, the same way your skin may sag or wrinkle in your breast sag, the same thing happens in your genital area, in your vaginal area, and towards as well as the skin that surrounds the opening where the urine comes out. It also sags as well and thins out, and this can predispose you to recurrent UTIs and infections in the vagina. So you have to be mindful of that. If you have recurrent UTIs, or you have vaginal dryness and intercourse is not pleasurable anymore, and you feel pain during intercourse, you can be eligible for vaginal estrogen creams. So the vaginal estrogen comes in different formulations, creams, rings, So there are different options to explore with your healthcare professional. So we have to target the symptoms. And the most important time to start the HRT, hormonal replacement therapy, is within this perimenopausal timing, because this is when most of the symptoms may occur, but we call it the window of opportunity. And if you do not get the symptoms in the first 5-10 years, it's unlikely that you may experience the symptoms later on. There are other conditions that may overlap with these symptoms, and these will then need to be investigated if they occur later than your perimenopausal transition or the anticipated menopausal years. So to conclude off the talk, as everybody has touched on endometriosis. Endometriosis is one of the gynecological disorders that most women experience. And as Kengiwe and the other speakers have explained, is when endometrial-like tissue grows outside of uterus, causing inflammation and pain. So the lining that you're supposed to shed during a menstrual cycle is found outside of the uterus. It can be in the tubes, around your ovaries. Some people even have endometriosis in the belly button, where you find the same tissue that you shed during your menstrual cycle on your umbilical button, literally outside. So every month you have a period, your belly button may also bleed. And some people in the extreme forms can get endometriosis in their chest and their lungs. So really this endometrial tissue can implant anywhere outside of the uterus, and it becomes problematic. So there are different stages of endometriosis. It's staged into 4 stages, but the stages do not always correlate with the pain severity. So every woman is different, and we shouldn't dismiss women depending on what their stage is and what their symptoms are. Every woman experiences pain and symptoms differently. So why do some women get endometriosis and some women don't have endometriosis? So there's no exact cause of endometriosis, but there are several strong theories that exist and have been explored. The one theory is that some period blood flows backwards into the pelvis, so from your uterine lining into your tubes to the fimbria. So your tubes have hands that are open to receive eggs. So the uterine lining can shed essentially backwards instead of outside onto your pad or tampon. So that's one of the theories. And one of the other theories is the immune system theory, where then these cells are not cleared properly. And the other theory in layman terms, when the pelvic cells change into endometriosis cells over time. So we are made of one cell line that multiplies and divides and changes to different cell lines to form hair, your eyes, your skin. So there's that theory that the cells in your pelvis may then, over time, change into endometriosis-like tissue. And then there's the genetic theory that it runs in the family. And the other theory is the inflammation in the pelvis that helps those cells grow. So for some women, it's multifactorial. It can be multifactorial. It can be that you are genetically at risk of developing endometriosis, and you find that a few women in one family may have endometriosis. And so it can be multifactorial, but there's no one proven theory. As I say, it's just theories that have been explored within the medical field. So we've mentioned the symptoms briefly, but these symptoms are often debilitating to a point where they affect your quality of life. You can't, it starts affecting your relationships. It starts affecting your presence at work. So it becomes very difficult, and it can also affect your fertility depending on the stage as well. And the issue with endometriosis is that sometimes the symptoms overlap with other issues. Like I said, I have IBS, so someone else can have endometriosis and inflammatory bowel disease, or may have adenomyosis or fibroids or other issues that are in the pelvis. And just because someone has fibroids or adenomyosis or other issues in the pelvis does not preclude them from having endometriosis. So there's always, most of the time, a delay in diagnosis because of the overlapping symptoms. What are the treatment options? The treatment options depend on the stage and the symptoms that the woman experience. Pain relief. We can use anti-inflammatories. As we said, it's an inflammatory condition, and your hormonal treatments to reduce bleeding and pain. So when young women have very bad period pains with or without endometriosis, sometimes the way we control the period pains and the heavy bleeding is with contraception. Remember, I said contraceptions are also hormones. And the reason most people have pain during their menstrual cycle is because of the withdrawal and dip in the progesterone. Progesterone, in its literal meaning, means progestation. Progestationing meaning pro-pregnancy, right? So the progesterone maintains that lining so that the pregnancy can implant in it. So if pregnancy doesn't happen, there is no pro-pregnancy hormone, progesterone. It withdraws. It's the withdrawal of the progesterone that causes the heavy cramping. And so the hormonal treatments can target that to prevent the whole cycle of a lining buildup and lining shedding that happens within the uterus and outside the uterus. So the hormonal treatment can help in this regard. And another form of hormonal treatment, we have the oral contraception method, and we have the loop, the intrauterine system, the Mirena, for long-term control. So we have different loops. We have the hormonal loop and the non-hormonal loop. So for endometriosis, what you'd want to use is the hormonal loop, right? Because you want the side effects of the hormones within that loop to counteract the hormonal dip of the progesterone and all the symptoms of endometriosis. There will be no use to use a copper T because there's no hormones in the copper T. And then we opt for surgery to remove endometriosis for severe cases. So this is after we've used all forms of other hormonal treatment, modalities, pain relief medication, and depending on the staging, if it's severe, we remove the endometriosis. And if someone is struggling to fall pregnant, depending on the stage as well, we do surgery. And for severe or complex endometriosis, it's important to refer to a specialist gynae or someone who has subspecialized in endometriosis surgery. It becomes complex because there are other organs that can be stuck because of this endometriosis inflammatory process. So lifestyle modifications and a multidisciplinary team is very important when we're treating these patients, because it can take a mental toll on patients. The stigma of not being able to fall pregnant, the debilitating pain that makes you stay away from work, or the one that affects your relationships, because once it's deep and infiltrating in your pelvis, sexual intercourse is no longer desirable. You start having relationship issues. So it can take a mental toll on patients. Not just endometriosis, any other diagnosis is very important to work in a multidisciplinary team and tailor treatment towards your patients and not apply a one blanket approach. So in conclusion, hormonal imbalances are common, they are treatable and they are manageable. Your PCOS, menstrual irregularities, endometriosis, and menopause need holistic care. Diagnosis and treatment need to be personalized, no one blanket approach, and women deserve evidence-based and compassionate treatment.
Sure.
I'm done.
Thank you so much
for having me and listening.
Yes. Oh, yeah. I think that was a full classroom. I think we are all educated by now. I had so many aha moments. And we are running over time. I'm so sorry for that, everybody that has tuned in, but I think these are very important conversations and very important information that we need to have. But thank you so much, Doc. Thank you so much. So we will move on to our final speaker, Busi. She is the founder of RODI Wellness. So you guys know every movement begins with a story. The founder and the director of RODI Wellness, Busisiwe Matlare, is here to share her personal journey, one that led to creating functional smoothies and natural wellness pathways for women. Busisiwe, the floor is yours.
Thank you so much, Tuli. Thank you so much, Doc. It's quite difficult to come after you after that informative session, but I'll try my best. Good evening, everyone. My name is Busi Matlare. I'm a mom, I am a wife, and I'm the founder of RODI Wellness. And tonight I speak to you not as an expert in health, but as a woman or a lady who has went on this journey with endometriosis and hormonal imbalances. So from the age of 16, I was diagnosed with endometriosis and I was on contraceptives and pain medicine, and that is how we were treating it for most of my adult life. I was very fortunate to have 2 girls, and then after the second one, that's when life changed for me, and what was working previously stopped working, and I started having dips of hormonal imbalances, and I tried quite a lot of contraceptives in that period, but unfortunately my body bleeding. I was bleeding more than I did not every month. And yeah, so that was my journey during that time. And that lasted for well over a year. And during that time, I could relate a lot, not in a dramatic sense, but with the women with the issue of blood in the Bible, because I bled quite a lot and I was spending a lot of money going from this to that. And yeah, that was my journey. And then fast forward towards after a year, my doctor referred me to an endo specialist. And during that time, that's when I decided to try something new. And that's when I formulated the smoothie. And that's how RODI Wellness was born. But tonight, I'm not here to speak about the smoothie, but I'm here to just equip ladies and empower them, because I think what was fortunate for me during that time is that I had support, and the multidisciplinary team that is on here today. I found support from them. I know the back pains after having my daughter, physio actually helped with that a lot. I know seeing my doctor helped quite a lot, and she had to turn into a therapist from time to time to just comfort me because it was quite a lot. And yeah, and then the nutrition also came and played a huge role. So I just wanted ladies to know that there is help out there, and that um, you shouldn't feel disabled in the situation, but look out for questions, like ask questions, ask for support, join webinars like these, get educated, and take the power back. Don't allow yourself to feel like you are not strong enough to beat this thing, or even to manage it to a point where you can be the best you or the best version. And hence this webinar this evening. So not to take extra time or more time, let me hand over to Tuli so she can continue with the questions and answers. But thank you everyone for joining, and let's hear the questions. I'm sure our experts are way keen and excited to answer.
Thank you so much. Thank you so much, Busi, for such an inspiring story. I'm pretty sure most of us can relate to that journey, and we're all seeking for solutions, and trying to lead a better lifestyle. We now move into our open Q&A session. Please keep your questions short and clear. And to our professionals that will be answering. We please keep our responses crisp. Yeah. Then we'll take live verbal questions from now on. Does anybody have a question for any of the speakers that were here? Or can I go first? I actually had a question for Neshri. So, Neshri, how long does the postpartum back pain last for? I have a 7-year-old and a 2.5-year-old. I had 2 C-sections and a what do you call that injection here on the spine?
Epidural.
Yes, an epidural. I had 2 epidurals and I am struggling with back pain, severe back pain. So how long does it last for? Am I ever going to have a normal back again?
You should. You've never sought physio help?
I have. I do go to a few physio sessions. And what she mostly recommends is my sleeping style. And
Okay, so I'll touch on it quite briefly. So there's a few things that happen after you have a C-section. Obviously, they're cutting through lots of layers. So they're taking away your support. Your core muscles support your back, not the other way around. So when they take away that support, your back feels very vulnerable. And what it starts doing is it's trying to do the job of the core, whereby it's starting to tighten. So all the muscles around that area becomes extremely tight. And if we do not release it with myofascial release, stretching, dry needling, those type of things, it will tend to carry on. And then we go into our chronic back pain cycles, right? So the other thing that might happen also is at the injection site, when they gave you the epidural, sometimes they can irritate the nerve and the nervous tissue around it. And it takes very long for that nerve to actually heal and become better. So physio, usually how we usually do that is we use devices to I can say deactivate the neural system so that it blocks that pain gate pathway and it starts to heal so that we're not getting that irritating lower back pain. But it is important to obviously start with releases and then go on to core exercises, specific core exercises for your body and what you're going through, not generalized, and then pelvic floor activations and breathing exercises. Changing your sleeping patterns can help, but we also have to look at your job, your posture, what's happening there, what shoes are you wearing, things like that can influence the balance between all of the muscles. So it's not just one part, unfortunately, it's everything that needs to work together.
Okay, thank you.
Possibly see a pelvic floor physio just to cover all your bases. Yes.
All right, thank you so much. Does anybody have another question for any of our speakers? I see there are questions in the chat box, but I can see that some of our speakers did already address them. And yeah, does anybody?
Yes, actually.
One.
Yes, okay. Go ahead, Zanele. Thank you so much.
Thank you. Where can we reach our what's this panel? Sorry, the physiotherapist. Where can we reach the different specialists that spoke? We need information, please.
Oh yes, definitely. I did on the posters that you guys did see to actually join this webinar. We did post their social profiles, so you can reach out to them. privately, and you can consult with them. I'm pretty sure they will be more than willing to help. Right, guys? Yeah, but we did post their social media pages on the main what do you call this, on the main program.
May I quickly answer?
Yes.
I am currently based at RODI Medical Center in Campton Park. I work with Dr. SM Kalunji and in Raslow, Centurion. And hopefully in the new year, we'll be in the center and surrounds.
Awesome. Thank you so much. I think maybe can we all the speakers maybe post their emails or their websites so that we can be able to reach them in the chat box, so that whoever is willing to get some help privately can be able to reach you.
Hi, Julie.
Yes. Hi, Yvonne.
I'm having lots of questions, but let me just reserve them, hoping to get the contact details of the doctor. Is Dr. Pule the one who's based at RVAPE?
Mute. Yes, I'm going to post. Yes, I'm going to post the secretary's number to contact to make an appointment or inquiries, if you may.
I've called, I think it was last week. They said they don't have the diaries yet for 2026. I wanted to book for January.
Okay, send a text to the number and say Dr. Bule said, and then Tabi will send it. I will answer directly myself.
Okay, doctor. Thank you so much.
Who am I talking to?
One of my gym mates from Family Fitness. She's your patient. She's the one who referred me to you.
Oh, great. Awesome. So I'm going to post the number and I will answer directly to you.
Okay, doctor. Thank you so much.
Thank you. Bye.
I'm having lots of questions. Thank you.
Thanks so much. Thank you. This was
do you want to share? Sorry, Tuli. Yvonne, do you want to share some questions or one or two questions with us here that you don't mind sharing that we can also learn from?
Yes. The questions. The first one is of the hormonal loop that you talked about, and the other one is removal. I think it's the removal of endo. I wanted to ask if it's removed, will it still come back in the near future? Are you removing it or are you removing the uterus? Hormonal imbalances, what medication should one drink to help with hormonal imbalances? And I think that's all.
Okay.
And the other one I wanted to ask as well from RODI Wellness about the smoothie juice, something that helps as well. Thanks, doctor.
Okay, I can start. I'll just try to remember all the questions, but for your endometriosis, it depends. So first and foremost, it can be a clinical diagnosis depending on your symptoms and what you respond to. So we start with the medical treatment. If you're having severe period pains, debilitating pains, and the type of pain you have that's related to your cycle, right? And there are specific hormones that we use for endometriosis. So if your doctor suspects that you're having endometriosis, you can either use a Versan. It's because of the specific hormones in the Versan. And we have a WHO stepwise approach to the pain management. So you work through the pain medication with your doctor. If all those don't work, So endo evolves and it does grow, it does go through the different stages. So if there's doubt in diagnosis and there's no response to treatment, we can do surgery. Surgery can either be done in the form of keyhole surgery to either get a diagnosis, meaning to get a sample. If I go in with a camera or I open the abdomen, look, and there are deposits. So the deposits will be the menstrual blood that you see when you go to your period. Those small clots can be implanted either on your stomach, your bowel, your ovaries can have big cysts that have chocolates inside. By the time you have big cysts in your ovaries, you're already stage 4. So that's advanced endometriosis. So we remove those cysts if you're already at stage 4 and all the pain medication hasn't worked, or you are struggling to fall pregnant. Yes, endometriosis can recur. So the only time we do surgery is if your medication, the multidisciplinary team, pelvic floor exercises, physio, psychotherapy, and all the alternatives are not working. In severe cases, we do essentially what we call debulk. Debulk meaning unburden the body a bit to give you relief, either for pain or to be able to fall pregnant, because those cysts can also make your chances of falling pregnant lesser. Okay, so not everybody gets surgery because the surgery is to buy time and give you relief. So people who are struggling to fall pregnant and people whose pain medication and hormonal treatment is not working. We debulk, unburden the body so that we can revisit and buy ourselves time and room to use those other treatment modalities. So it can recur, and we don't remove the uterus. By the time we get to removing the uterus, what is your goal when you're treating endometriosis? Is it for pain relief? Is it because you're struggling to fall pregnant? If you're done having babies and all the treatment modalities have failed, we can remove the uterus. So it depends how old you are, what the treatment goal is, and what you've tried in the past. And then you said something about the loop.
Yes, the hormonal loop.
Yes. What about it?
I think I just heard that one of the treatment is a hormonal loop.
Yes, so the hormonal loop that we use is the Mirena. So contraception is hormone. So in the hormonal loop, there's a hormone that gets released in the loop that stays in the uterus, and the Mirena, the levonorgestrel, lasts for about 5 years. So once it's in the uterine lining, that loop, right? It can stay in there for 5 years to treat the symptoms. It releases this hormone, and what happens is that it prevents the buildup of the uterine lining. So most people who go on the Mirena, either their cycle becomes less or they don't go to a cycle at all. So meaning your period is not going to go to a period, if I might put it simply like that. So the chance of retrograde meaning backward flow into the pelvis, is also reduced. And it also balances your hormones. Remember I said it's the withdrawal and dip of the progesterone that causes the contractions. And the contractions happens where? It happens in the uterus when you get period pains. It happens wherever that endometrial lining is. So if it's in your belly button, that lining is going to contract on your belly button, and it will contract and it will bleed. If it's in your stomach, it's going to bleed, contract and bleed on your stomach lining. If it's in the ovary, that lining is also going to have a period. It's going to contract and bleed wherever it is. So people who are treating hormonal issues or cycle problems, we don't usually use the copper T. We use the Mirena because the Mirena has hormones in it. For people who only want to prevent pregnancy, the copper T is more than enough, but it's not going to help with your period pain. It's not going to help with your heavy flow.
Okay.
Okay, doctor. Thank you so much, doctor. I'm
Hi.
asking for your number.
Yes, posted.
Okay.
Sorry, doctor, can I just in there because you're touching on a question that I just actually posted right now.
Yes.
So I previously used the copper tea, and that didn't work very well for me. It gave me extreme heavy flow, infection for days. I just had this foul smell. I think I had it for a few months, and then eventually I went to the gynae, who put me on, removed it, put me on treatment, and then recommended the Mirena, which is what I'm using now. So I don't see a normal flow. And that's now my question, is that what impact or effect does it have on my body or health, not if that's reversed,
So
as you've explained?
remember I said the Mirena protect the lining buildup. So what happens? So depending on what your cycle was or how heavy your period was when you start the Mirena, if you have a light or normal flow, once you're on the Mirena, your period will either stop completely, but you'll still have some mood swings, not necessarily mood swings per se, but you know when you're going to your period.
Yes.
You either have
Yes.
ovulation pain, you know, okay, or some people will just have spotting or stop completely. So what do you mean it's affected your cycle? How has it affected your cycle?
So I'm a normal, usually on without using anything. My flow is just normal.
And how
Now
is
that
it
I'm
now?
using the Mirena, it's very light, very light.
That's
I use a
normal.
liner. That's how light it is. But I
So
still
that's
experience the, I don't want to say mood swings, but I can pick up on the change in my mood and the cravings. Those symptoms are still there.
So that's normal. So the Mirena works just in the uterine
Okay.
lining. It's systemic, so it prevents that buildup. It reduces the buildup of the uterine lining. So if you are a normal flow, you either spot. If you are heavy flow, so we also use it for people with abnormal bleeding. If you have an abnormal bleeding, it lessens the flow, but you'll still know when you're going to your cycle because your cycle is not only working on your uterus, it's all connected to your brain and your whole body, right? So it works on the uterus and it reduces your flow because it prevents that lining, that buildup of the lining in the uterus. So there's no buildup of blood. So when you use it, there's no buildup of blood. So people have this tendency of saying that if they don't go to their period, there's blood that gets clogged in their uteruses. That's not true. The buildup of blood in your uterus is because of the fluctuation in your hormones, and when you bleed is because of the withdrawal of the progesterone. So if you use certain contraceptions that target those hormones, there will be a change in your cycle.
Okay.
Yeah.
Got it. Thank you.
Okay.
Yvonne, just to briefly answer your question about our smoothie, it is 100% natural. It's farm to bottle. It is going on trial because it has helped me so much and other ladies who are using it. So pretty soon, we'll be talking more about it. But for now, you can either contact us on WhatsApp or Instagram and we'll give you more information. Thank you, ladies, so much. I just want to take this moment to thank my speakers. Thank you so much, ladies, for a great session. And for my husband, who's been the tech guy here right beside me, thank you so much for the support. And each and every one of you who logged in, thank you so much. And I pray that you all have a blessed evening. And Tuli, you can take over.
Thank you so much, ladies and
thank
gentlemen.
you, Tuli. Sorry. No, and the lady of the moment, Tuli. Thank you so much. A special thank you to you for running this so smoothly. Thank you so much. Bye.
Thank you so much, ladies and gentlemen. Thank you for joining us tonight. Thank you for our incredible panelists for sharing wisdom, science, and a lived experience. Thank you so much, Busi, for entrusting me with this role. It was my first time doing it, but yeah, hopefully many more. Just a takeaway message, may every woman here walk into wholeness emotionally, physically, and spiritually. Remember, your body is not working against you, it is speaking to you. Thank you so much. May you have a beautiful night. Thank you so much, everybody.
Thank you so much, Tuli. Thanks, doctors. Sleep well.
The doctor, appreciate. So informative.
Thank you. Thank you. Thank you, Tolu. Thank you to everybody that logged in. Thanks, guys. Bye.